There she
Hey,
is.
how are you?
I'm good. I'm good. So happy to have you.
Same. So I just want to like preface, it is chaos in my house right now, so I'm locked in. But if you hear something in the background, please disregard.
Don't worry. I'm locked in. I'm here at the office, you
Okay,
know.
perfect.
So, yeah, but I'm so happy that you're here with me. I know that a lot of our patients have been hearing your name, and while we've worked together and have known each other for, I think it was 8 years, we were doing the math now. I'm
It's
so happy.
a long
It's
time,
been a
girl.
while. It's been a while. We were babies. We had just started our practices down in Coral Gables, and I remember you were with IVF Florida at the time. I was with Dr. Dabney at the Coral Gables Wellness Center, and we've moved. Now we're in Broward. I know you were in California for a while with your dad, and now you're back here in South Florida, and I couldn't be happier. I couldn't be happier to obviously have a friend back here, but to have such a trusted and esteemed colleague that I know my patients will benefit from, and just the care, the feedback I'm already getting. So thank you for what you
Oh,
do. Thank you for joining me.
for that intro. I'm like, oh, girl, okay, let's do this all night.
Yeah. No, but it's true. I mean, my patients, they know the care at OVA is very catered. It's very it's like a sisterhood, almost like a sorority. We're all they're patients, but they're friends. We're invested. And when it comes time that my patients need to go to IVF, when we've exhausted our options, when we feel it's the next step, I get a lot of feedback. I've worked with a lot of IVF doctors. This OVA has been in practice. This is our 10th year in practice.
Congratulations.
I know. Thank you. And throughout those years, I've had babies with so many doctors, but you notice patterns. You see things that the patients are talking about, and one of the main things patients ask me is, I want a female doctor who understands, who does IVF, who is up to date with all the newer things that come up. And I try my best to always stay up to date with who's around. But when I found out you were here back in Florida, it was
Oh,
just
you're so sweet. Thank you so much. So, I mean, top that intro, right? Like that's beautiful. Thank you. So, just to provide a little bit of context, basically, I finished training back in 2015. And as you mentioned, we were babies. I took my first job in South Florida, and then moved out to California. And that was supposed to be the forever gig. Like that was, I love my Central California patients. Still lots of roots and very, very attached to many patients there. But I married somebody who was born and raised Fort Lauderdale. And so after 5 years in Cali, he was like, look, we got to make our way back there somehow. And so I really, coming back, I didn't know everybody, but I knew many of the players that were in South. And ultimately, you're good. I'm just gonna keep talking. And ultimately decided to just, hang a shingle here in Fort Lauderdale and really, I have so much more medicine to practice. There's still, so many more years ahead of me that I felt like, why not start now with the practice that I want to build? And I'm not looking to be big. I really want to focus on personalized attention. We have a relaxation room in the office. And I very, very much believe in the complement of adding the adjunct of both Eastern and Western medicine. When we were chatting before this, we talked a lot about it's not either or. It's not, one or the other. It's very much how do we optimize the patient's journey and how do we give them the best of both worlds and the best of what we both can offer. And I think that's really beautiful because at the end of the day, all that's doing is setting them up for better success.
Correct. And I think that's one of the main things when patients are looking for IVF. They say, I don't know, there's so many people, where do I go? And oftentimes, there are franchises, there's these bigger offices that we all know of, that I work with. But the care, a lot of times patients will tell me, well, I need something a little smaller, more personalized, where there's maybe one or two physicians in the practice, not that variety because of scheduling, because a lot of things happen. So I think there's something for everyone. But definitely that is a big difference that I love with your practice is not just we do IVF here, but it's the transparency with the patient,
Yeah.
how we're prepared. So, I love working with you, with other physicians that understand the process, because it makes a difference. For example, when patients, as an acupuncturist that specializes in reproductive medicine, when patients want to have a baby, they come to me, they're going to go to IVF, and they'll tell me sometimes, hey, IVF, my retrieval is next month. What can you do for me? And those times it pains me, especially when I know that woman had poor ovarian reserve, not the best quality of eggs. It pains me because I know, had her IVF doctor said 3 months ago, hey,
Right.
start working with OVA because we need to prep you for that retrieval, we would have such a different result, because acupuncture is one of the only modalities that can improve AMH, that can improve the quality of those eggs. So when we see a patient that has a retrieval in 2 weeks, it hurts us because we know we could have done so much.
Sure.
We could have,
Sure.
and it's not about more eggs. That's a big one for other patients. I don't want you to have 27 eggs. We're not having 27 babies. We want good quality. And the secret lies in 3 months before that retrieval is that sweet spot. And I get my patients that come referred from you and they'll tell me, oh, I saw Dr. Sueldo, which I love hearing that. I'm like, oh my God, it's happening. Like, she's here. The patients are here. But yeah, they'll tell me I saw Dr. Sueldo and she wants me to do 2, 3 more months of acupuncture before we do the retrieval. She wants me to do red light therapy. She wants me to do, and when I hear those things, it's like music to my ears, because I know we're not just a number churned out, like boom, boom, boom. We're taking our time. We are telling them we can't rush it. This is what we need. And those are the patients where you see we have 1 round, 2 rounds, and we're done. We get our success. The patients respond well because we're priming the body. We're preparing the patient. We're not just throwing her out there like, figure it out. And
Right.
that makes such a difference.
Yeah, I think there's a couple different thoughts there, right? So one is obviously the patient who has been on the journey for a long time. She wants to be pregnant yesterday. So she's like, okay, I don't care. Let's just do IVF. Let's go, 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 go. And so then, you know, the conversation there, and I have this probably at least once a day, is, you know, look, when things go well, everybody's happy. I'm the hero. It's great, beautiful,
Of
right?
course.
But when things don't go well, you don't want to look back and wonder, like, woulda, coulda, shoulda, what if we had done this, what if we had done that. And for most patients in Florida, IVF is not a treatment that is covered by insurance. So it's a huge financial expense. It's a huge physical expense because the patient is coming in almost every other day for blood draws, for procedures, interventions, anesthesia. I mean, it's huge, right? And then ni hablar the emotional toll, right? The emotional investment that goes into IVF. And so at the end of the day, why wouldn't we do everything possible to say, okay, if it works, great, wonderful. And if it didn't work, you know, all right, then at least we know we did absolutely everything we could. And I think what's really, and so that's one thought I have. And then the second thought is really around the time, right? And you talk about 3 months, and we can kind of get a little bit more into detail about that. But many supplements, when we talk about red light therapy, we talk about resveratrol, CoQ10, et cetera, we talk a lot about 3 months minimum. And so what patients, you know, 3 months is a long time in the fertility world. So many are like, 3 months, like, what are you talking about? But if you look at the study, really it's that 12 weeks minimum. And then from there
That's when you
on,
see the change.
right, exactly. And then I would just add, you know, a third thought, that in the same way that you see a fertility specialist, right? Because for me, I did 4 years, well, I did med school first, and I did 4 years of OB-GYN, and then I did 3 more years to subspecialize, right? And so you have male reproductive specialists, you have female reproductive specialists, et cetera. So in the same way that you would see a specialist for this condition, when you're working with integrative practices like acupuncture, it's really important to work with somebody who's focused in on reproductive health, because it does make a difference in the same way that my world makes a difference, right?
Correct. So, you know, I tell my patients with acupuncture, I love acupuncture, practice acupuncture, because it is a modality that is so effective with different things. You know, excellent for back pain, sciatic pain, migraines, and it is very effective. This is why I love it. But when it comes to IVF, ovulation, sperm quality.
Right.
A general acupuncturist is not going to understand the depths, the layers, the interactions. A general acupuncturist or a sports acupuncturist, when you come tell him, hey, my estradiol is elevated and I'm taking Lovenox, is that going to do? They're going,
Right. Right.
you
Right.
know,
Just like if you talk
those,
to me about an ortho problem, right? I'm gonna be like, your shoulder, what? Like, I don't know, go see an ortho guy, right?
yeah,
And I know this is, not a detail for today's discussion, but I just want to bring this up briefly since you mentioned about sperm quality. Last night, I spoke to a group of a fertility support group. It was a group of women, very well educated. Many of them had been in treatment, some for a very long time. Not one of them had heard for acupuncture for men. So do you mind just like 30 seconds, just give us like the 30-second thing
absolutely.
for men in the world of fertility?
Absolutely. So when it comes to with women, our protocol, 3 months, I see my patients and I see them weekly because that's how long it's going to take for that primary follicle to mature and ovulate an egg that has the effects of what we've been doing. With men, it's a little different. It takes them about 30 days. So our cycle, our frequency changes. I see them about every 1 or 2 weeks for about 2 to 3 months.
Okay.
But the changes that we're seeing when it comes to morphology, when it comes to motility, there's supplements, there's herbs. Because what I tell patients is, yes, we're the women. When you think fertility, everything's pink. It's us. However, the embryo is 50%
Right.
him. If we were like, an earthworm that could just reproduce on its own and just boom, that'd be great.
Right.
We're not.
Right.
So when we're putting 3 months, weekly acupuncture, herbs, all this into our female patient, and we're not even looking at the male, that's a red flag. So again, with acupuncture, when we have issues, motility, morphology, they're gonna take different herbal formulas, but for the most part, it's our 30-day minimum that we do treatment. And with that combination, we're seeing a tremendous difference, mainly in morphology is where I see a lot of those patients that everything's good, morphology is just a little off. Give 6 weeks of treatment, we have a new sample and we've corrected. Obviously, there's lifestyle changes, but
Of course.
the varicocele. We have issues with varicoceles. A lot of patients that they have the issues, and it's not until we go to IVF oftentimes that we find out there is a varicocele because we wouldn't
Right.
know. So a lot of those things that you see and why I love working, with the IVF doctors is because we go back and forth. When we have a varicocele, I tell them, yes, let's get it corrected, but now we need to have treatment, acupuncture to get all those things functional again, to make sure that those sperm cells are nice and healthy as they should be. When it comes to that motility, that shape, the direction. These are all things that oftentimes, unless our patient, they go to IVF, they don't even
Think
know.
about.
So
And I
they
want to add,
don't find out.
I want to add one other thing here is, when we talk about the 3-month timeline, patients are like, oh my God, that's so long, et cetera, et cetera. But if you think about, most patients take about 4 to 6 weeks to get all the testing done.
Right.
And then you have to meet for a follow-up visit. And then let's say you're going straight to IVF, for example. There's typically a prep. It's not like you can just call and start, right? So there's typically a prep, a checklist to make sure you order your medications, you sign all the consent forms. So typically that takes another, let's just say 3 to 4 weeks. So by the time you're actually starting, you already are at that 2 to 3 month mark. So if the doc is recommending it at the new patient visit and you are starting that at the new patient visit, think about that timeline really doesn't make that much of a difference because you're doing all of the other things in the meantime anyway. So I just wanted to highlight that because I think sometimes patients are like, oh my gosh, 3 months, like no way, I'm not doing that. But if you really think about the timeline between testing, prep,
It's
treatment, etc.
months are there. The 3 months are there. And when I get patients that come see me off the bat and I tell them, listen, I want you to call Dr. Sueldo. I want you to make the appointment because that's the other thing. By the time that you have the availability that the patient gets there. So we need to be proactive. And that's where the success lies.
Right.
I love working with my colleagues. So, for example, I tell them, let's get the appointment with Dr. Sueldo. Let's get that sperm analysis.
Right.
Let's get the appointment set up with her. Let's meet with Dr. At Signature Perinatal with Dr.
Yeah.
Sasha Davidson, a perinatologist. Let's do a preconception visit. Where's his sperm analysis? Do we have an issue? Where's your progesterone? Is it low? Have we had issues like this before? And if so, let's get you where you need to be before we start trying to conceive. And it's in those 3 months. I even tell the patients, let's get everything. And oftentimes, even in prep, patients that want to go to IVF, I tell them, all right, we're going to go see Dr. Sueldo. We're going to get ready. You're going to make the appointment. You're going to get blood work. You're going to get ultrasounds, all of that. And then they get to the blood work the week before going to see the IVF doctor. We draw blood. Boom, we're pregnant.
Love it. Those are my favorite stories.
I
Those
love
are my
those.
favorite stories. Yeah.
And I told them at the end of the day, listen, we want the sex. We want you to have a baby. Like we want you to have a baby, you know, and that's the beauty about a team that we're on that same page.
Yeah.
Now, if making those changes, if getting you know, we use the Ovasitol for insulin resistance, so many different things that we change. As women, I've met so many educated women that have no idea how insulin rises and falls, how to pair foods. And it's like, we're not taught that. So in those 3 months, all those changes oftentimes do make that difference. And hey, our patient gets pregnant, we have a beautiful, healthy pregnancy. But that's not all the time. And when that doesn't happen,
And again, that's where the whole like collaboration, and it's not either or, it's collaborative, it's additive, it's, you know, adjunct, right?
Correct.
It's like, let's work together, let's do these things in combination. I had a patient call, she wanted to do this natural fertility program, and I said, great, why don't you do both? Like, why does it have to be one or the other?
And they told me, well, I wanted to see you before I saw the IVF doctor. And I said, but why?
Right.
I said, I want her eyes. And a lot of times people, patients think that, which is why I think that having the right IVF team, your doctors that are collaborating, there's not an either or. We all want this to you know, work, because even when we get pregnant, if we didn't see the perinatologist to get everything in order, now we're racing at time, you know, what if something happens? Could we have a miscarriage?
Right.
So, you know, it really, it makes all that difference. And I tell patients all the time, athletes train more for the Boston Marathon. Your basic person trains more for the Boston Marathon than they do for pregnancy, which you're going to be pregnant for 10 months. You'll labor on this, and we don't prep. And I think that that in itself is where so much of that success lies. Specifically, I wanted to talk to you about some of our patients. So because of what we do, we're a reproductive acupuncture practice. All we do is PCOS, hormones, periods, babies, pregnancy, all day. It's on a rotation, all day, bread and butter. But with those patients, oftentimes we have a lot of women that are over 40, pregnancy over 40. And oftentimes even they'll tell me, I went to the IVF doctor. They straight up told me, listen, it's a donor egg. Like, that's about it. And they'll come to me because they say, I'm not there yet. I'm not ready. You know, and I tell them, well, here's what I can do for you. Give me 3 to 6 months, herbs, acupuncture. We're going to put her all into it. We get periods regulated. But I always like to get us ready for IVF. Tell me a little bit more about working with women in their 40s, pregnancy. What's your take?
Say that's probably a solid like 30 to 40% of my practice. It's a lot more common than people think. I had one of my old partners used to say that the 40s are the new 30s, just the ovaries didn't get the memo.
It's true.
So I stole it from him. But basically the concept, you know, there's a couple foundational things, right, that I want to start with. And I think the first one that's super important is shared decision making. So when I talk about a fertility journey, at the end of the day, it has to be the patient's journey. So my job as the doc is to really make sure the patient is educated, make sure that they understand what the stats are, what the literature says, what the available options are. But at the end of the day, if the patient decides to understands all of that and decides to move forward, I'm going to hold her hand through that journey, right? Because I think as a doctor, that's really where your job lies. Your job is education. Your job is informed consent. Your job is management of expectations, and then ultimately guiding them through that journey, whatever they decide. So that, I think, is one kind of really important foundational piece, I think, in the fertility journey.
Absolutely.
And then the second thing is the reality of the biological clock, right? So when we talk about ovarian aging specifically, we talk about egg quantity and we talk about egg quality. Egg quantity we can measure, egg quality we cannot. So egg quality is inferred based on patient age, other diagnoses like PCOS or endometriosis, etc. And the classic paradigm that we are still taught today is that ovarian aging is unidirectional, which means that women are born with all the eggs they're going to have. They lose those eggs as they get older, and there's really no reversing that. So it's unidirectional in that it only goes down. In the last, I would say 3 to 5 years, there's been more and more research that is suggesting that that may not actually be the case. And I'm going to get a little bit, sciencey here, but
That's what we're here for.
The idea is that men have the cells in the testicle to generate new sperm every 3 months. So they can actually be parents much later in life. So the thought was, if the gonad is essentially the same in men and women, how come men have those cells and women do not? So then we went digging and said, well, maybe they have those cells, but they're actually dormant. So is there a way for us to wake up those cells to try and generate new eggs, right? Or increase that quantity. So there's a lot of research around that. There's a lot of experimental things that are going on right now. You mentioned reversing or increasing the AMH level with acupuncture, which I have also seen, actually, by the way, with acupuncture alone. And that would speak against that paradigm, right? Because theoretically, if it's unidirectional, it should never go back up. And yet we have all had patients where we have seen that increase. And so I think the paradigm is what we're taught. I think that's how we counsel patients. But I think we also need to understand a little bit of that lies in the limitations available for testing and treatment, right?
Science, of course.
So I do think that there are treatments out on the horizon that are coming that are really hoping to try and reverse that. Now, what's less clear is, can we reverse the quality? So we believe that we're going to reach a point at some point where we can impact egg quantity and where we can increase egg quantity. And, some people, I won't spend too much time on this today, but some people are doing things like supplements, like the red light therapy you mentioned at the beginning, like PRP or plasma.
The vaginal ozone, so many different things. And, I'm Mexican, so in Mexico, I was just in Mexico.
Yeah.
And I made a little bit of time and I went to one of my good friends, Dr. Karshmer. He actually helped me conceive my daughter, which we'll talk about that one day. But I was, he told me, he said, hey, hay un congreso, come. I said, yeah, I'm going, And even in Mexico, there was different, in Colombia and Mexico, different procedures, different things that are being done. So not even just the fertility here in America, but what is being done across the board. Which is why I love our field. It's just the growth in the past 5 years, the potential of what's to come. But more importantly, like you said, it's not even just about new things, but as we're looking deeper into literally what's here, we're understanding so much more about eggs, about just so much more about the potential, what we can do, the effects of good and bad, those epigenetics, those 3 months prior, just all the difference. And as the more we do, the more we're learning. And I think that as patients, that's what people hear when they come to OVA, they're looking for. They want more options. We don't want to hear the same. I've seen patients that were 6 IUI cycles in and nothing has been changed. It is the same protocol from the first one to the 6th failed one.
Right.
So
I think, kind of circling back to the question about, fertility in women over 40, I think it's important to understand sort of the concept of biological aging. I think it's important to understand what some of the statistics are around that ovarian aging. So when you talk about success with IVF, when you talk about the likelihood of a normal embryo, when you talk about the risk of miscarriage, all of those things are important to discuss. But I do think it's important for patients to understand, if there's one message, if you remember nothing from today, is that Well, one, this is your journey. So maybe it's two things to remember. One, this is your journey. So feel empowered to advocate for yourself and feel empowered to explore all the options and to really make sure that your doc is the right fit for you. I always tell patients, I'm not going to be the right fit for everybody, right? I'm going to be the right fit for my patients. And so it's really important. There's enough fertility docs in South Florida that you can really find the right fit for you. And then I think the second thing is that when you reach 40 and above, every passing year, the changes are acute. So when you look at the ovarian aging process, it's actually fairly static. You see kind of a fairly straight line until about age 35. Technically, there is decline after about age 20, 22, but that decline is so minimal that you don't actually see it on a graph. And then after age 35, so between 35 and 40, we see kind of this diagonal line, right? So it's slow, it's progressive, it's continual. And then after age 40, that line becomes much more vertical. So from 40 to 41, from 41 to 42, from 42 to 43, the changes are much, much more dramatic. And so when you see the decline in the quantity and quality, there's a huge difference even from 40 to 41, 41 to 42, 42 to 43. And so so when we talk about pregnancy over 40, it's not just this loose term like, oh, every 40, whether you're 40 or 47,
No, every year.
two very different things, right? So every year that passes, there's a huge change, not only in your fertility, but also when you talk about pregnancy, right? And the complications associated with pregnancy. So super important for patients to understand that. But if patients are educated, if they understand all of that, then why not? Why would you not optimize that, right? So of course, and here's the thing about the fertility journey. I'll add a third thing, right? That when you talk about fertility treatment, and you talk about the concept of third party, so going to egg donor, going to embryo donor, going to sperm donor, etc. It's easy to say, but it's not easy to do, right? Because you're mourning the loss of your own genetic child. There's a huge grief, a huge loss that comes along with that. And then if you do decide to use donor, are you going to use someone you know, someone you don't know? And then you have to add the expense that comes along with that. I mean, it's a huge shift, right, in the treatment plan. So not to say that it's not the right option for many, many people. And here in the US, generally speaking, we're very blessed that third-party reproduction is so open and is so available. But I think particularly on the medical side, we need to be careful when we're talking about these things because there's so many other considerations besides just getting the patient pregnant, right? Sure. It's what is the emotional component to this? What is the time to pregnancy, et cetera? There's so many things. And I think that's where when you talk about adding things like supplements, adding things like acupuncture, and really trying to optimize, it's a huge component of the emotional aspect of this process as well. Because let's say we do all of that, let's say we do IVF, and let's say it doesn't work. At the end of the day, you did everything. I mean, you really gave it everything you had. And there was nothing left on the table. And a lot of times emotionally for patients, that does make it easier to then consider the transition. But if you didn't do acupuncture, or if you didn't do supplements, or if you didn't do some of the other things, right? Then the question becomes, should we maybe consider doing this again? Should I try acupuncture alone without that? And that's when they end up with you where, when it could have potentially been a different approach. And so I think those are some kind of of the large concepts without getting into the nitty gritty that I think are worth mentioning for that population group.
Of course. No, it absolutely is. And like you mentioned, the time with it, whether it's patients that are actively wanting to start the IVF process. I have a lot of patients that want to freeze their eggs. These are all things that we need to take into consideration. Yes, we want to do it. Yes, we want to be quick. But I think one of the reasons why our patients do come to OVA, why they trust our referrals, is because we're going to be honest. We're going to be very honest and tell our patients, listen, it makes no sense to do this retrieval, to invest all this money, to put all these drugs, which are very, the drugs used for IVF, it's not Advil, this is not Tylenol, these are strong drugs. So we want to limit to the amount of drugs that women do have to put into their bodies, the least, the better. So when you look at all this investment, why wouldn't we be number one, prepping, and two, having these other procedures that are going to go hand in hand. Same thing, like I said, when I do have my patients that are, in their 40s, and sometimes people say, oh, well, I don't want you to tell me that I need IVF anyway. And I tell them, I'm not going to tell you whatever. When patients come here, they're going to hear my honest opinion, what I really think is going to come out of this case, because we don't just, no part of medicine is less than any, but we're not just taking out ingrown toenails. Like, we are trying to help people have babies.
Yeah.
So what the expectation, the preparation, what we do, and the mindset that our patients go into, that is major in the success that we're going to have with whatever practice they go with.
Can you just speak to, because I think a lot of times, especially my women who are professional women, particularly healthcare women, like, I don't have time for acupuncture. Like, give me pills, give me whatever. Like, I'll take all the supplements you want, but I don't have time for acupuncture. Can you just tell me or walk through, like, what does a typical visit look like? And just so patients can have an understanding of, like, timing, not even investment financially, but just investment of, like, getting to the appointment, doing the appointment, like, how much quote unquote sacrifice does that actually require on their part? I think that would be really helpful to hear.
It does, absolutely. When with your reproductive acupuncturist, you see me a lot. You see me weekly. So like I said, I need at least 3 months prior to that retrieval to give you the results that you want. If we're talking about, I need to relax, I want to improve my circulation, we could do that. But if we're wanting to get that retrieval going, actually get good quality embryos, 3 or 4 of them, we're meeting 3 months prior. We're meeting once a week. When they come in, because of our clientele, we have hours even up to about 8 o'clock. Sometimes you see me here in the office super late, because we know our patients come weekly. So we do make sure we have hours that better accommodate weekend hours, evening hours. So they come in, patients are here for about an hour or so every time. And then at home, they have their capsules, which they take every morning, their Avasitol, whichever formula. As we get closer to IVF, when we have the retrieval, I always see them before the retrieval. I see them before the transfer, after the transfer, those 9 days after transfer that are pivotal for implantation. Do we want to make sure that we're lowering that immune response, we're increasing circulation, keeping progesterone nice and high. All that is happening. So the frequency in which I see patients varies a little, but usually it's a bi-weekly visit, about an hour or so.
Hour. So instead of doing your Netflix one night a week, you just go see.
Just come over. We have snacks.
I do think that's really important, because I feel like patients think it's going to be this, like, big, like, thing. And I don't think it has to be. I think it is what you make it, right? And if you're trying to do all the things, if you're limiting the environmental exposures, if you're converting to glass, if you're incorporating supplements, if you're doing the fertility diet and all that stuff, like, why would you not do acupuncture? Sometimes it baffles me. So I wanted to just highlight that before we move on to the next.
Absolutely. And it's a difference because of the frequency. They think, well, I see Dr. Sueldo like every so often. Well, it's very different things that we do. You know what I mean? So oftentimes I'm there in the beginning. I'm getting you ready. I'm like prep, so that we can get to that big day, but it's all that prep work. And that's what a lot of people don't see. When we already know that our success rate of IVF it's not a crazy high success rate, especially as we get older, especially as you add other factors. I have PCOS, I don't ovulate. Like, when you add them, it just, But when we have acupuncture, the research has shown that we can improve higher rates of up to 68%. And that is a tremendous improvement on what we would normally have. When we're talking about a patient who has done several cycles, we know, like, why would we go into this again the same? And that's why I refuse to do that with my patients. I say, no, we're going to break it down, see what's going on. Let me get you in the best place that you can be. And oftentimes there are women that, oh, I get a period every 3 months. By the time we go into IVF, she's having a period every 29 days, ovulation on day 14, like clockwork, that even the doctor goes, your follicles look great. What have you been doing? And I tell them, this is the why. This is that work that you see, that weekly. The reason why is because we want to go in, we want to do it once, and we want to do it right.
Right.
And that takes prep work. my patients know what to expect. Oh, thank you. and my
Love
patients,
the comments.
right? I know. We made twins. Those are
Oh,
twins. I love those babies. I
oh,
know. Those are from Coral Gables, actually.
oh, I love it. That's
I know.
awesome.
I know. So yeah, like I said, I'm so happy to be able to work with a practitioner like yourself that really understands that it's not just a, hey, you know what, let's get you in and see what happens. This isn't see what happens. We're not throwing something on the wall to see if it sticks. We're making humans. We're forming families. You know, sometimes when I hear that, I'm like, what do you mean? He said, we'll see what happens. Yeah. So knowing that there is someone, and I love working with women. I mean, listen, working with another con otra Latina to me is always such a blessing, and being able to bring that to our patients makes me so happy. I know oftentimes when I bring IVF up, patients get like a little like, oh, they're like, that's not why I'm here for. I'm like, I know, but we want to do the groundwork. And if that's where we go, then that's where we
Yeah.
go. But I oftentimes send them to you because I know, and I want my patients to know yours as well. So type of acupuncture, today we're talking about reproductive acupuncture. So we're talking about acupuncture getting you ready for IVF if you're trying to conceive. So with patients that are interested in seeing you and learning a little bit more about IVF, or even not just the IVF, but let's get a sperm analysis. Let's get an HSG. Let's see if your tubes could be blocked. Like we need to do some groundwork. I always extend them to you. I know that you have a meet and greet link where patients are able to have a brief consult, not to get the consult on their case, but to get to know you a little bit, your practice, your thoughts, and your approach to IVF. OVA does something similar, and we actually want to extend to your patients that come with a referral. We want to do the same, offering them a consultation where if they're considering IVF or if they're already doing IVF with you, they'll be able to have a consult with me and see along their timeline how we can help them and where we can better improve. So tell me a little bit about what's the best way to reach you.
Yeah. So one thing I just wanted to touch on, because you said it best, is I think patients, there's a big stigma around seeing a fertility specialist because, oh, they're just going to make me do IVF, right? And so I think sort of dispelling that myth and saying, no, listen, if you see a fertility specialist, the first thing they're going to do is a deep dive into your history. The next thing they're going to do is they're going to do a whole boatload of testing. And then the next thing they're going to do is then they're going to talk to you about fertility treatments, which there are many. So if you're young, you have PCOS, lifestyle, integrative practices, acupuncture, all of that is going to be hugely important. And they may talk to you about doing medications with intercourse. They may talk to you about then maybe moving on to IUI or inseminations. And then, of course, IVF as our most effective option. So I think it's really important to just dispel the myth right now that seeing a fertility specialist does not equal IVF. It just equals I'm taking the next step and being proactive in my journey.
We want to work with clarity, and I tell them
Yeah.
whether it's with me, with Dr. Sueldo, we want to work with clarity. We want to know where we're
Exactly.
at, where we need to go, and how as a team can we come together to fill in those gaps that we're missing.
Exactly.
And again, and if along that way we get that positive pregnancy
Yeah,
test,
beautiful. Love it. Great.
listo. We did what we had to do.
Exactly.
So
So then when I built out, or when the idea really came, so Sabo, by the way, is the national flower of Argentina. I really wanted something, I wanted something with symbolism, something that spoke to my roots. For those that don't know, my family's from Argentina. I lived there for almost a decade, many, many ties still to Buenos Aires in that area. And so when I was thinking about Sabo and putting it together, it was really the relationship, because that's where I thrive, right? The patient-doctor relationship. I love that. I'm still connected to patients from my first year, from 8 years ago, that are like, hey, this is a picture of my boys. They're in whatever, right? Like first.
I've seen them on Facebook.
And so, and I know I'm not going to be the right fit for everyone. I totally understand that.
And we want to be the right fit for the right people.
Right. And so the idea of the 15-minute call, the 15-minute meet and greet really came about because I put myself in the patient's position, right? This is a big step, trusting somebody with your fertility journey and really wanting to make sure that they are the right person for you. And so that call, usually we talk mostly about myself, if they have any questions about me, any questions about the clinic. And they'll usually give me kind of a broad overview of the case. And, I can, like, for example, I'm just thinking about somebody who ended up with me after all, but started with, I think XYZ. And I was like, well, maybe let's do your partner first. Don't see me, go see a urologist. And then if need be, like I can get involved or whatnot. Well, now they're patients with me, but I'll be, I don't think, it's not like I'm trying to get everybody in the door. Like I think it's, well, let's see what the case warrants, and then we can decide what the best next step is. Most of the time, the best next step is a visit, right? A consultation to go into everything, deep dive. There's no way you can cover. I mean, my visits average anywhere from 45 to 75
Same
minutes.
thing. I look
So
sitting my patients hour and a half. I want to know it all. Like I want
right.
it
And
all the
so there's
details.
no way in 15 minutes that you can like
No.
hear the whole thing. But I think it's really helpful. Patients can hear your voice, they can hear your expressions, they can hear how you answer questions. And they can ultimately decide, is that something, do I think this is going to be a good fit or not? So that was something that I started probably about a month or so into practice, and I don't think I'll let it go. I think it's really the initially there was a lot, now there's less.
Yeah.
But because patients are moving straight to the visit straight away. But for that patient who's on the fence, like I definitely think that is a worthwhile, 15 minutes for you and me. And I may say, look, I may not be the best fit for you, right? Like, I mean, and that's okay too. So I think it's really important to have that offering. And I love that that's something that you'll do for my
Absolutely.
patients, because again, I think in the same way that they're trusting me as their fertility provider, if you're seeing the acupuncturist once a week, like that's a lot of FaceTime.
I know.
Like
And
you
like I
want to
tell
make
them,
sure that it's the right
correct.
fit, right?
Correct, because we're gonna see each other for a while. And you have to. Patients oftentimes tell me, I've been to so many doctors, I've gone through so much, I still don't know. And I tell them, well, that ends here. I see you weekly. We're working for 3 months. You're not a medical mystery. You're not broken. You're not an enigma. You would be somewhere locked up, like,
Right.
at Johns Hopkins being studied. You're not.
Yeah.
But what we haven't done is we haven't gotten to the bottom of it.
Right.
We haven't broken it down. We haven't been
Right.
consistent, and we haven't stuck with it. And that's what I do. And
Right.
once we do, that opens just such a difference, such a world, even for as women to understand our bodies and to really not just look at it as such a foreign thing. Like, I don't know, you guys look at it. Well, I mean, we are, but I want you to look at it. And I want you to, and oftentimes I tell my patients and they're like, I don't know. And I ask them, what do you think is wrong? They go, I don't know. Like, what do you mean? I'm like, no, what do you think is wrong? What's off? And I promise you, 60% of women will tell me, I think this, and that. 9 out of 10, they're right.
Yeah.
Because we
know.
we do, but we're taught,
We know our
we're
body.
taught to
Yeah.
like, well, but I'm not no, I want patients to learn. I want you to be comfortable. I want you to ask me questions. I want you to know. I want you to understand what we're doing, because we're bridging this. Like, you're not just like this experiment we're working on. You're the magic.
Yeah.
Like, you're letting us do this. You're the magic, mommy. So like,
Yeah.
and we have to get to it. And seeing you 10 minutes every 3 months is not going to give me the answer. And it
Yeah.
would be unfair to categorize you as this unexplained infertility
Yeah.
when, I mean, the same physician hasn't even had 60 minutes of solid FaceTime with you in
Sure.
3 months. So again, it's not
Sure.
the magic and the needles. It's we're going to get to it. We're going to break it down. We're going to use the science, the data, and we're going to find where the anomaly is. And when we do, we're going to get to it. We're going to be consistent. And we're going to have a baby.
You know? Yeah.
That's how it works here. So I'm so happy to be able to have that, to bring all of your knowledge and your compassion and expertise to our patients, because Lord knows we need it in South
Thank you
Florida.
so much,
I
Dario.
love
Thank
that.
you. Yeah,
Thank you.
honestly, number one, I'm really excited to be back in the area.
Yeah.
And number two, I'm excited that we get to see each other again. We get to collaborate again, now just in Broward instead of Dade.
It's a
But like, it's all good.
takeover.
Right?
It was a takeover from day
Yeah.
one. But yeah, we're definitely going to be having a lot more events, a lot more of these conversations. I know my patients tell me, and I just have all these questions, and I love that we can sit and have this and just answer so many questions that things people just had no idea. So
well, I'll tell you, I'm going to hold you to it. National Infertility Awareness Week, last week of April.
We're ready. We're
ready.
I
got you, girl.
We're ready. We're going to have so much. And again, to those patients that do want to make that appointment with you, I know they can look up Dr. Carolina Sueldo, Sable Fertility, super Latina. We have you tagged on everything. And of course, here at the office in the front, we have all your information. Any of our patients that just want to know, we have the brochures, we have everything. And as well, again, for your patients, we can be called, emailed, DM'd. A member of our staff is always
Beautiful.
available. And we're happy, and we're ready to make
This was
babies. So
awesome.
that's
Thank you so
stuff.
much for having me on tonight. This was so fun.
Thank you. Thank you. I appreciate it so much. Thank you, everyone that joined us. And this is obviously going to stay on our Instagram, on our pages, so people can reference. But any question you guys have, DM us. We're here. We're happy to help. And thank you so much.
Have a good night.
Have a
Bye-bye.
good night, Mommy. Bye.